Hi, everyone. My name is Vanessa Templeman, and I am the Inspector General here at the Office of Inspector General over at Access. I want to welcome you all to attending our Access Provider Outreach and Education Program regarding our recovery audit contractor, otherwise known as a RAC, here with HMS Gainwell today. We are going to be bringing up another slide deck here as soon as we can get that up.
Can you share that?
I
I'm pulling it up here. Let me see.
Thank you, Melanie.
Okay. Can everyone see that?
No.
Oh, okay.
Yes, this is it. Thank you very, very much. Today, we are going to be doing a big education and introduction into what the scope of the Recovery Audit Contractor Program will be here with Access. And we will be talking about a variety of different clinical and payment analytical reviews that will be occurring. If you want to hop to the next slide, please, that'd be great. So our agenda today, we're going to talk about, as I mentioned, what the RAC program is. We will be outlining what the audit process is, what you can expect, how this will flow. We'll be talking about what the scope is and how this all has come to be, what the review process will look like and what you can expect, and what additional provider resources and information will be available to you through different websites. As I mentioned, my name is Vanessa Templeman. I'm the Inspector General. Many of you probably have received a variety of different outreach letters from us as part of our normal audits that we occur or perform on a regular basis. And we have partnered with a variety of you to work through some of those different questions and items that we have. And I look forward to continuing that type of coordination and partnership as we work through these new audits that are going to be coming your way. On the call today and providing some additional information are going to be David Johnson, who's the Senior Medical Director, Mary Stein, who is the Senior Director of Clinical Services, Melanie Fields, the Account Manager, and Natasha Levy, who is the RAC Solution Architect. I have worked with the majority of these persons as we've developed and gone through some of the scope, and they have been great to partner with. So I know everything they're providing today and future partnerships are going to be just as great as well. All right. And yep, with that, I'll hand it over to you, Melanie.
Okay, sounds good. Thank you so much, Vanessa. Let me go down here. All right, so just a little bit about HMS. Again, my name is Melanie Fields. I'm the assigned account manager for Access, and I'm very excited about this partnership. Health Management Systems, otherwise known as HMS, was founded in 1974 with a mission to deliver healthcare technology and analytic solutions to help reduce costs and make the healthcare system work better for everyone. Since 2010, HMS has been partnering with the states to implement Medicaid RAC programs required under the Patient Protection and Affordable Care Act. HMS was acquired by Gainwell Technologies back in April of 2021, and we remain the market leader in this Medicaid space. HMS brings more than 36 years of experience working with Medicaid clients, and we provide services in 51 of the 56 states and U.S. territories and support over 60 million Medicaid beneficiaries. In addition to the recovery audit services we also provide cost containment, systems integration, and data analytics services to many commercial and government clients. All right, I'm going to go ahead and pass it over to Natasha to go over HMS RAC Solutions.
Thank you, Melanie. So for today's presentation, we will begin by first providing an overview of the program scope and then an overview of the review process. We'll dive into key elements of the program, such as the medical record request process, the type of complex reviews we'll be performing, the notifications you'll receive, rebuttal instructions, and lastly, audit program details and resources. And that'll be available to you, which we'll talk to in the next few slides. So we'll first begin with the review scope and what types of reviews HMS will perform. The review program consists of two types of reviews. One is a complex review and the other is an automated. The key differentiator between a complex and an automated review is the requirement of a medical record to determine payment appropriateness. Now, a complex review requires clinical documentation to be reviewed by a clinician and/or certified coder, depending on the type of review that is being performed. An example of a complex review would be a DRG clinical coding and validation. An automated review does not require a medical record. An improper payment is identified by data-driven algorithms, identifying improperly billed, coded, or paid claims. The algorithms are built based on regulatory and policy requirements, as well as industry standard rules. There are additional qualifications that are going to be applied to the overall scope and the reviews that are being performed by HMS. The first is what we call a look-back period. A look-back period is defined as a threshold that's applied to the claim data, specifying how far back a review can occur. For Arizona Healthcare Cost Containment System, they have a 5-year look-back period, which is based on the beginning date of service of the claim. In addition, we want to speak to the claim types. For access, all claim and provider types will be subjected to review under the program. It's important to note that the scope of the audit, the type of review that we'll be performing, will be approved by the state of Arizona prior to HMS conducting any type of audit. Next slide. Okay, the process in front of you starts with provider outreach. Today's presentation is a component of the overall provider outreach program, and there's going to be other resources available to you that the next speaker, Mary, will discuss. Now, in the case that Access approves the audit type, we initiate our process. Access has implemented another layer of approvals, and this is at a claim level. Once we've identified the claims you want to pursue for audit, we will submit that claim detail to Arizona. Now, once they have approved the audit, the process looks different depending on if it's a complex or automated review. For a complex review, as I noted previously, it requires a medical record. This means that HMS will mail a medical record request letter directly to you. That letter will give you 30 days to submit the medical documentation. If the medical documentation is not received within those 30 days, you will receive a follow-up medical record request letter, providing you with an additional 30 days. Once HMS receives the medical documentation, we will complete the review. That review will be completed by a clinician and/or certified coder, depending on the type of review being performed. Once we have completed the review, we will notify you of the review results. Based on the review results, if we did not identify an improper payment, we will submit a letter to you. That letter will indicate that there is no further action at this time. If we completed the review and it's resulted in an improper payment, we will then issue a preliminary finding letter, and that letter will provide you with instructions to submit a rebuttal directly to HMS. If a complex review was performed, the preliminary finding letter will also contain the clinical rationale to support the improper payment. You will then receive rebuttal timeframes for submission to HMS. Once the rebuttal timeframe has exhausted, the claim will then be submitted to the state of Arizona, and they will initiate the formal action and fair hearing process instructions. And now I'll speak to the automated process. As you can see on the flow, starting with once we've received the approval from Access, you will notice the flow chart skips the request for a medical record and the medical record review, but it moves directly into the notification of the improper payment. So again, for an automated review, a medical record is not required. Once we receive the approval from Access, you will receive the preliminary finding letter. And everything I went over specific to the finding letter during complex reviews holds true for automated reviews and includes the reason for the overpayment. I'm now going to hand it over to Mary to provide an overview of the complex review and audit resources.
Hi, good morning, everyone. This is Mary Stein, and I lead the clinical policy and clinical quality teams with HMS. So I will jump right in here and we'll be talking about medical record requests and submission process. Once claims are selected for review, providers can expect to receive a medical record request letter. Medical records will only be requested for the claims or sets of claims selected for review. The medical record request letter will include instructions for submitting the medical records to HMS, the list of claims to be reviewed, and the number of days you have to submit the documentation. Medical record request letters are sent via USPS mail to the address provided by Access. So please ensure your address is correct and up to date with Access. If medical records are not received within the requested time frame, HMS will send out a follow-up medical record request letter. And then I just also wanted to call out that we've developed a dedicated toll-free number to handle any of your inquiries. So the toll-free number is listed here on your screen, and it will also be included in those medical record request letters. Submitting medical records. Submitting medical records electronically is the fastest and most convenient way to send your files. We encourage all providers to submit records via Secure File Transfer Protocol, or SFTP for short, or through the HMS portal. Either way, the files will be transferred securely. You can set up an SFTP connection by calling the HMS Provider Relations Center, or feel free to email us at gogreen@gainwelltechnologies.com. You can also self-register for our portal account at hmsportal.hms.com. And both of those links will be provided again later in the deck. So after you're ready to start sending files through your new connection, here's a few tips to help ensure your documentation is received and processed properly the first time. First, importantly, ensure you have provided clear, legible documentation with good quality image scans. Be sure to include the medical records for the full dates of service requested, making sure your documentation covers all dates of service. The record should support the services provided and be a complete medical record, including physician orders and physician documentation. One special note I wanted to call out is if we receive medical records with missing or incomplete documentation, this may result in a technical denial. So be sure to submit complete records. The next couple slides cover our provider portal. The portal is a cloud-based solution that allows providers to manage activities with HMS. Within the portal, providers can effortlessly locate medical records. You can verify claim status, submit appeals, upload your medical records, and run reports. The portal will help improve speed, reduce costs associated with mailrooms and paper, and improve the overall provider experience. This next slide covers some of the key features and capabilities within that provider portal that I just mentioned. So I'll call out a few of the features here. The portal allows for real-time claim status updates with HMS, so you can ensure medical records were received, review results, look at rebuttal status, access letters. It also allows for 24/7 access to claim status information. There's a dashboard view that provides status of all historical and current claims within the audit process. And the HMS provider services support is provided for ongoing education, user registration, and inquiry resolution. We also have HMS help desk support with the portal to help with any access issues. And then also within the portal, you can access detailed user guides, and those provide step-by-step instructions on how to navigate through the portal and its key functionality. There's also on-demand trainings available. As far as capabilities, providers will be able to locate medical record requests, upload medical record documentation, submit a rebuttal or an appeal. You can view, print, or obtain copies of letters. You can verify claim status. You can also update provider addresses or points of contact. There's a My Workload queue that reflects all outstanding claims requiring provider action, And then you'll be able to also run reports. So lots of really great features available to you within the portal. Next, we'll be providing an overview of the clinical claim review solutions. So we'll start with place of service review. For the place of service review, we're reviewing targeted inpatient claims to verify that the place of service billed by the provider was consistent with the patient's condition and the care and services provided as documented in the medical record. Clinicians review the medical record to verify that the level of care matches the clinical documentation to support billing services as inpatient. The reviewer will determine, based upon the medical record submitted, whether the patient's condition and care provided required an inpatient level of care, or if care could have been safely delivered and is routinely provided in a less intensive setting or location. The review is not a determination of medical necessity of services, but rather ensures payments are consistent with the services provided and documented. If HMS finds an inpatient stay that was billed in error, in most cases, a provider can rebuild the claim for the appropriate level of care and receive reimbursement for services provided. Guidelines and criteria. For the place of service review, HMS will review those targeted claims to verify that inpatient level of care was billed appropriately. Registered nurses perform the place of service review utilizing clinical review judgment to determine whether the patient's condition, the care provided, require inpatient level of care, or could have been safely delivered or are routinely provided in a less intensive setting. The HMS physician team develops job aids using current literature and standards of care in the medical community to direct all review activities. They also provide oversight to the quality and appeals programs and are available to assist reviewers in cases as needed. Next, we'll be reviewing the DRG validation review solution. For DRG clinical and coding validation, HMS reviews targeted DRG claims to verify that all diagnosis and procedure codes were billed appropriately in accordance with coding guidelines and were consistent with the documentation in the medical record, resulting in accurate DRG assignment and reimbursement. We're reviewing the medical record and validating the DRG from both a coding and a clinical perspective. For DRG coding validation, that coding perspective, it's the process of verifying the codes were billed and sequenced in accordance with official coding guidelines. DRG clinical validation verifies that the diagnoses coded were present based on the clinical documentation in the medical record, and the results of related diagnostic testing were consistent with those diagnoses. In cases in which there is a conflict between the diagnosis coded and the associated clinical indicators for the condition, the diagnosis will be removed from the grouping, which may result in an assignment of a DRG that more appropriately reflects the medical documentation. For DRG clinical and coding validation, there are 5 key elements that are verified during the review process. We're ensuring that all diagnoses are billed on the claim, were coded accurately and are supported by the medical record, that the clinical documentation and results of diagnostic testing support the bill diagnoses. We ensure all procedure codes were coded accurately and are supported by the medical record, that the discharge status code and any other elements impacting DRG assignment and reimbursement were coded accurately, And lastly, we look at any hospital-acquired conditions to ensure they were coded with the correct present on admission indicator, resulting in accurate DRG assignment and reimbursement. Guidelines and criteria for our DRG validation reviews. HMS utilizes official coding guidelines as well as industry standard criteria and definitions to substantiate the bill diagnosis codes affecting the DRG. For clinical validation, the diagnoses documented in the patient's medical record are substantiated by criteria that are accepted by the medical community. These criteria typically come from professional guidelines or other evidence-based sources. This slide provides an example of the clinical criteria that HMS would use in the validation of the diagnosis of sepsis. So to validate sepsis, HMS utilizes the third international consensus definition, better known as sepsis 3, as the evaluating criteria for payment purposes for the diagnosis of sepsis. This is a standard currently being used in the medical community. In this definition, sepsis is defined as a life-threatening organ dysfunction caused by a dysregulated host response to infection. For clinical purposes, organ dysfunction is represented by an increase in SOFA score, or sequential organ failure assessment score, of 2 points or more. This is associated with an in-hospital mortality rate greater than 10%. Substantiation of this criteria within the medical record would be necessary to clinically validate the diagnosis of sepsis. Now we'll discuss our automated reviews. These are also known as payment analytics reviews if you're used to hearing a different term. The automated audit identifies claims improperly billed, coded, or paid according to regulatory, policy, contractual, and industry rules. HMS executes its proprietary rules engine against paid claims data to identify improper coding, billing, and payments. As mentioned previously, a medical record is not required to determine an improper payment for the automated review. Rather, identification occurs by comparing rules to claims data elements. HMS proprietary rules engine is configured with rules customized to Access's specific policies and direction, and Access approves each improper payment type prior to any audit activity being initiated. Findings from the automated audit analysis are reported to Access. Now we'll be reviewing the clinical review process. So after we have received the medical records that were requested, one of our experienced clinical reviewers will perform an in-depth review of the submitted documentation. Reviews are conducted by registered nurses, certified coders, clinical auditors under the direction of an HMS medical director. HMS reviews the claim information to validate that the services, coding, and billing are all consistent with the submitted documentation. Our quality assurance program ensures that determinations are accurate and consistent with guidelines. Turnaround time is dependent on our contract with Access, and HMS will provide notifications to you once the review is complete. The findings are reported to Access along with payment decision outcomes, excuse me. And now I'm going to hand it over to Natasha.
Thanks, Mary. You can go to the next slide. This portion of the webinar will address the preliminary finding and formal action notification letters, as well as the rebuttal and appeal process options if you should disagree with the RAC determinations. So again, the initial notification of an improper payment will be via the preliminary finding notification letter. This letter will provide the improper payment reason. If the improper payment is the result of a complex review, the letter will also include detailed clinical rationale to support the determination. Upon receipt of this notice, we understand that there will be instances where you do not agree with the audit findings. The preliminary finding notification will include instructions for you to submit a rebuttal if you disagree. Next slide, please. I now want to provide additional details specific to the preliminary finding notification. The letter itself is comprised of two components. There is the cover letter page, and then there are subsequent pages that we refer to as the audit detail. The preliminary finding notification cover page will provide you with instructions if you agree with the improper payment. The letter will also provide instructions if you disagree. Again, you must submit in writing directly to HMS, and the rebuttal must be received within 30 days of this letter. The audit detail pages will provide you with the claim detail, all of the claim information that's tied to the improper payment. Most importantly, it also includes the actual reason for the overpayments. And again, if it's a complex review, it will include the detailed clinical rationale to support the improper payment. If we mail this letter to you and we do not receive a request for a rebuttal or a refund or a request for a payment plan within 30 days of this letter, we will submit a follow-up preliminary finding notification, which also provides you additional timing. And lastly, specific to our complex reviews, if we completed a complex medical record review and it resulted in no improper payment being identified, you will receive a no further action letter from HMS. Next slide, please. As I mentioned, the preliminary finding notification letter will state that you must submit a rebuttal to HMS in writing within 30 days of the date of that letter. Now I want to perform a deep dive into the rebuttal process. The initial preliminary finding letter that will be mailed to you, again, will provide you with rebuttal instructions. The rebuttal must be received to HMS in writing within 30 days of the notification of the improper payments. We make every attempt to reduce the burden of rebuttals for all parties, so the preliminary finding letter we mail to you will contain detailed and specific information. Upon receipt of a rebuttal, should you disagree, HMS will provide the outcome of our review in writing to you via the uphold or overturn letter. Next slide, please. There's one of three letters that you may receive in response to a rebuttal that you've submitted. The first is an exhaust letter. If the rebuttal was not received within the time frame specified in the letter, you will receive notification indicating that we did receive your rebuttal request, but it was not received timely. If we completed a review of the medical documentation that you submitted, and our review identifies that no findings of improper billing exists, based on the documentation submitted, we will mail to you a rebuttal overturn letter. If we completed the review of that additional documentation and we've concluded the initial determination was accurate, we will provide you with an uphold letter. Next slide, please. As I indicated, you'll be given an additional 30 days to submit a second level rebuttal. The 30 days is based on the timing of the first level rebuttal uphold notification. We will again provide the outcome of the review in writing via a second level rebuttal uphold or overturn letter. And we will share all rebuttal review results regardless of if it's a first or second level with access. Next slide, please. So in today's deck, we've included a breakdown of the second level rebuttal response letter, which is the same as the first level. If the second level response was not received timely, you will receive a second level rebuttal exhaust letter. If we review the additional documentation you submitted and we identify improper billing exists, we will mail a second level rebuttal overturn letter. If we've completed the review of the additional documentation and we've concluded that our initial determination was accurate, you will receive a second level rebuttal uphold letter. Next slide, please. Access will be issuing the formal action demand notification letter. This letter will indicate that a RAC improper payment exists and provide fair hearing instructions directly to the State of Arizona Office of Inspector General, OIG. Any fair hearing request must be submitted within 60 days from the formal action demand letter. This letter will include instructions for requesting a fair hearing, and again, it must be submitted within 60 days, and it will also provide the claim information related to the RAC finding. I'm now going to hand it over to Mary to complete the remainder of the presentation.
Thanks, Natasha. All right, our last section will be discussing resources available to help support providers. So HMS has established a dedicated provider relations line to help address any questions or concerns you may have. When providers receive a medical record request notice, the provider relations team can help provide better understanding of the review process. They provide instructions for submitting medical records, or they can address any additional concerns you may have. We view our one-on-one discussions as ideal opportunities to provide education, to answer questions, and to alleviate concerns. These conversations can help with the natural unease you may feel about the review process, help you understand what's required of you, and help understand our findings. Next slide. The dedicated provider relations line is listed here on the slide. And as I mentioned previously, it will also be provided in the medical record request letter. The provider relations team is available Monday through Friday, 8 a.m. to 5:30 p.m. CST. And again, you can call and ask questions about any letter notifications you've received, how the audit process works, verify claim status, or any additional questions you may have. Also on this slide, we have the link to the provider portal. So you can access the provider portal, which allows providers to manage medical records with HMS, including submission of medical records, review claim status, submit appeals, and finding letters. And then we have also listed here a link to the provider website. And this website is a great resource for provider education. It provides an overview of the review process. There's also frequently asked questions there. So definitely take a look. You may have questions as we move forward here, and that's a great place to get answers. Education and outreach. HMS and Access have developed several educational resources to help educate providers on the review process and ensure transparency. Many of those I know we've already talked about previously, but I'm going to run through them again for you now. So the first is the provider notification. This document provides advance notice of audit activity and upcoming provider webinars, such as this one, and it's available on the Access website. Next, we have the HMS provider website. Again, this is a great resource to get an overview of the audit and review process, access those frequently asked questions, and access other notable links. Provider webinars, such as this one, are going to be pre-recorded and provide overview of audit and review process, and they will also be available on the website. Telephone calls and emails are another great way to reach our provider relations team that are going to be available to answer your inquiries and provide additional information on the RAC program. And then lastly, as mentioned in previous slides, we have the provider portal. This allows providers to manage medical records with HMS, such as submissions, status, letters, reports, etc. So please be sure to take advantage of all of these great educational and outreach options. Thank you so much, and I will hand it back to Melanie.
All right, thank you so much, Mary and Natasha. I guess now if Vanessa, if you have nothing further to add, we can open the floor for Q&A.
I am more than happy to open the floor for Q&A. I've been trying to respond to as many of the questions in the chat, and I think maybe we can go through some of those really quick that are kind of repetitive just to kind of get them out of the way. I think one of the very first questions I'm seeing that I've been responding to a lot is, when is this going to go live, or when can providers expect to see letters? And my answer has been pretty shortly here. This webinar is one of the very first steps of providing the information and the notification of these RAC audits, and also providing resources and information. So pretty shortly here, should you have a claim or claims that are selected as a part of the audit, you will be receiving those letters. Another question I keep seeing is, how will HMS or Access know where to send the letters? We will be utilizing the addresses and information you provided when you registered with Access with your provider type. So if you are maybe part of a hospital who has multiple provider types or provider IDs that are registered with Access, we will be utilizing the information that you provided when you registered. So when you register with Access, you're required to provide a correspondence address, a payment address, and a servicing address. So we will be utilizing the correspondence addresses. And if you aren't sure what those are, you can always reach out either into provider registration, or you can look at your provider profile to see what those addresses are. And if maybe things need to be updated, that's totally fine as well. I'm being asked, let's see here, when will the slides be available? And if we can put the HMS website into the chat. Are you guys able on the HMS side? Can you guys put your website and the links that you shared in the slide deck into the main chat that was going on so everyone can access that? And then I think the other main question I'm being asked is, if you are not a provider type that submits DRG claims, when will you be audited, and or could you be audited? The answer is there is not a timeline set up right now for when you will be audited. The answer is, as we design the next audit, once we get to that point, we will do additional outreach and additional information such as this webinar to inform of the upcoming audit as well. It will not just be a blind outreach. I do not know, as I said, what the second round of the audit will be and what claims it will focus on. We are doing one thing at one time and making sure we do a good job at doing that one thing at that one time. Is the fair hearing level the same as a state fair hearing? That is correct. So I think just to kind of recap some of what HMS, has talked about, and some of the Access OIG normal processes, is that as items and records and different things come from OIG, we phrase and have all of our letters initially started out as saying preliminary, and that is for a purpose. We want to tell you, hey, we took a look at this timeline, these claims for this provider, and we think we have some findings here that show us there could be something wrong. And these are our preliminary findings. And so we want you and we invite you to respond back and let us know, do you agree? Do you disagree? Is there information you think we didn't consider? Somebody had in the chat, I don't know who it was, but it was a great point. Maybe there was access guidance given to you at that time that maybe I just didn't know about, or one of my reviewers didn't know about the time. And that's where we want to have that interactive back and forth for us to work through what these audit findings could be. And so as we reach out with those letters that will be coming, there's going to be information in every single letter that talks about the timeline, what we looked at, the claims. You'll have an attachment so we know what we're looking at, the medical records we requested, and kind of what we're seeing. And you'll be invited to respond back and participate. It's not an immediate final finding that's going to come out and say, hey, pay us all this money. It is, hey, we've done an audit. This is what we're seeing from our side, and we want you to tell us what you're kind of seeing and engage with us in those different steps. So the initial letters will not have hearing rights on them because they aren't final findings. They're simply us sharing what we think as we go through the process. When we get to the final finding, those are the items that will have a hearing right on there, and you will have, as every provider does, state fair hearing rights. So you have the ability to file for an appeal, to ask for an informal settlement conference, to submit more information, all of those different things that you normally do have for any of those final items that typically come out as an audit from OIG. And let me just make sure I got some of these other repeated questions trying to make sure I have them.
And Vanessa, did you get the link to the HMS RAC website? I want to make sure they got it.
Yes, it's in the main chat. Everybody
Yep.
should have it. It's in the main chat. There's also a provider relations line that's been shared. Thank you. So in the webinar chat itself is where I've been posting some information. HMS posted some information. So thank you guys very much. And you guys can access those links in those different portals. I'm being asked, I'll kick this over to HMS. What is a DRG claim? Has come up a lot.
Hi, this is Mary. Sorry, a DRG claim is an inpatient hospital claim that's billed by DMG or DRG or reimbursed through DRG reimbursement methodology.
Okay.
Vanessa, I think maybe the question was what would be a typical DRG claim that might come up? So, one of the findings would be acute kidney injury. So if acute kidney injury is the one of the diagnoses is pushing the DRG, and we make a decision that acute kidney injury was not valid, then that's going to change the DRG. So hopefully that answers the question.
All right. So with that, I'll open it up to, I guess, hands raised, and we'll go from there. I think I got the majority of the repeated or similar type of question. So, Kim, I can't tell who has the hands raised. Can you tell me and call on them for me, please?
Sure, no problem. Gian Anastopoulos. We'll go ahead and allow her to talk.
Apologies for butchering your name.
Sorry.
Can you come off mute there?
Yeah, you have to unmute yourself. Jean.
Can you unmute her, Kim?
I did. She has to unmute herself as well.
Okay.
I've allowed her to. Okay. Next one, Terry Manolastis.
Job. Hi, just a really quick question. Is there any kind of like a mock audit form or something that we know you guys are looking for so that we can kind of prepare our documentation to align with the audits?
A mock audit form. I'm not sure. I'm trying to draw a comparative to what that could be, but I think taking the root of your question, I can provide for you. When we send out a records request, we will say, hey, these are the claims we're taking a look at. You'll be provided the CRN information and or the patient name and date of service. And then we'll ask you for any and all documentation to support what was billed on those dates of service for that patient.
So nothing like I know Access, they've required quite a few different changes, like in biopsychosocial or something. And they gave us like a list of everything that they would be looking for. That would count down or whatever on making it not valid. You guys don't have anything kind of similar to that?
I'm struggling a little bit to visualize or cross compare to what you're referencing. So for the OIG on the items, and I'm more than happy to go back and just double check with our and when you say access, I'm assuming it's the fee for service side, or are you talking about the MCO side? So I'm not sure if you're talking about a letter directly from the MCO that did an audit that you were contracted with, or if it was access specifically.
Specifically, they just came up with a whole bunch of different things that they're required on certain things like treatment plans or biopsychosocials or anything like that. And then they let us know, hey, we're going to be auditing, and these are the things specifically we're going to be looking for. I just didn't
Okay.
anything like that.
So if you're talking treatment plans and those different things, it sounds more like it's behavioral health and not so much the DRG type. Is that correct or no?
Correct, yes.
Oh, okay, that makes sense. So I'm following you a little bit now. So on the behavioral health, to kind of circle it up a little bit, there has been extensive outreach from Access, identifying what needs to exist from the provider's perspective, both for the required documentation of a patient relevant to the policies Access has set up, and or should those items also be audited. That is a very different outreach than the provider types and the types of claims that we are looking to audit here. The types of items we are looking to audit here are specified and defined in Access policies, and there are a variety of different things. So these are going to be more inpatient and not the assessment and treatment plans that are set up for the different behavioral health types of claims. So I think that Terry is where it's not going to be apples to apples because they aren't the same type of providers.
Correct. Okay, I think I'm just misunderstanding. Thank you so much.
Sure.
Okay, let's go with Rick Hargrove.
I recognize that name because he had some good questions in the chat. Hi, Rick.
You can unmute yourself, Rick, and it'll let you.
All right, can you hear me?
Yes, we can.
Thank you. Just an observation, actually.
Sure.
It seems to me there are multiple different provider types on this call.
Yes.
And each of us is listening to what you're saying with a different reception, with a different, how does this apply to what I do? And it would be helpful for me to know that I'm a provider type 25, 39, and 40.
Mm-hmm.
So when I look at the RAC conversation and everything that was presented today, I need to know how does it apply to my group home services, my attendant care services, and my habilitation services. And there's a whole bunch of other people on the call that have medical related items. I mean, you asked me about DRG, and it's just like, okay, that's for people smarter than me. And so I guess that would be some feedback because I get a little bit lost in what's being presented here, talking about a hurt liver or things that are medically related because it doesn't feel like it fits into my arena.
Okay, that's good to know. I think I did speak and provide information from a claims perspective, as I thought that would be an easier delineation, for providers who would know if they submit DRG claims or not. But I definitely will receive your feedback and apply it going forward, that maybe there's additional ways to try to separate or bifurcate some of the different information to ensure the right providers are on the right call.
I appreciate it. Thank you so much.
Sure, thank you.
All right, next, Rebecca Fitzgerald. You need to unmute. There you go. Yes.
Okay, so I haven't had any luck with, I don't know if you can even help me with this, but I've kind of run out of options on checking claim status on the web portal. When I check claim status, I get an error message, which I did copy in previously. I don't know if you can see that. It's at 9:24. I'll copy and paste it again. And
web portal, Rebecca, is it the HMS web portal or the Access Online web portal?
Access Online.
Okay, so that's different from what this call is for, but can you throw your contact information in the chat and I will have somebody who handles Access Online reach out to you. I'm very happy to do that for you.
Because I've been unsuccessful with claim status, that when I email provider portal, they say, check the portal. And so I'm kind of stuck. So what information do you need from me? What
provider are you associated to that you're trying to access the portal for?
Ponderosa Family Care.
Ponderosa Family Care. And then can you give me your email address?
R Fitzgerald at ponderosafamilycare.com.
Okay. I will send an email as soon as this webinar ends and connect you with, I'm hoping some people that can help you triage through what the Access Online system needs to provide for you, as that's not something that I'm a part of, but I'm, like I said, happy to make the connection.
I thought because I've kind of run out of options, I would ask and see if you have any
absolutely
resources. Okay, thank you.
You are welcome.
Okay, next up, Angie Bernovich. Angie? Hello?
You look unmuted, Angie.
Yeah, that's weird.
Hoping, let's give her a few seconds, see if she can. Let's go to the next
Okay,
one.
sorry.
Wait, she's
Um,
trying to mute and unmute. If she hops in, we'll grab her.
okay. Katie Warwick?
Hi, yes, I wanted to know if you know if there are overpayments that are identified, is that going to be something that is recouped by the payer, or is this something that we can voluntarily send back via refund?
That's a great question. So in our letters that we send out, you will have a few different ways for it to go forward. You can take a look at the findings and be like, you know what, we agree, here's our payment.
Okay.
You can take a look and say, we agree with these ones, but not those ones. So here's a partial payment. Or if we get to a final finding and I issue, and in order for us to kick off the judicial process and have those hearing rights and items performed or enacted, I may have to kick off a notice of offset or something along
Okay.
those lines. And then we would then take the monies back that way. But there is a variety of ways to figure out how best to recover any potential overpayments that were identified.
Okay, great. Thank you.
Hello?
Hey, Angie, are you there now?
Can you hear me?
Yes, ma'am.
Yes.
Sorry about that. I'm not really sure why it took as long as it did. Hey, just a couple questions on acute care hospitals. So for the RAC audits, once this kicks off, are they all going to, is it going to be a variety? So in other words, the complex, the APDRGs, the different types of RAC audits are all going to come through? It'll be a mixture, or are you going to divide it up where it says, you know, this first quarter is going to be the APDRGs, the next quarter, you know, is going to be the complex case, you know, et cetera? Or is it just going to be, here's what we do, these are our various kinds, and it'll just all depend, and we're going to apply them all?
But I'm going to refer or defer, excuse me, to HMS for them to confirm.
Hello?
Yes.
Oh, okay.
Is there anyone on the HMS side that can confirm whether or not it'll be mixed, or are we rolling it out one type at a time?
It will be mixed.
Okay,
Okay.
thank
It'll
you.
be-
That's what I
and then-
thought.
Okay, thank you. And then the second question is, how do you determine how many RAC audits that each hospital will receive? I know that CMS caps it off. I think, if I recall, I think it's by bed size. You know, is there going to be a limit? Is there, you know, I think years ago it couldn't be past, I want to say 150 a month. You know, what are we looking at here for the number of audits that are going to come across monthly?
So CMS does have different standards for Medicaid versus Medicare. There is currently not a limit that we have as we are taking a look at the population, and we'll be going forward to identify what claims will be audited. I think, I don't even think, I'm going to just go ahead and say, if we start to see a high volume, or if you as the provider say, hey, wait a minute, you just sent me 50, or you sent me 150, or that I have some concerns over the volume, that's a question I would definitely want to engage with and go forward, back and forth with.
Okay, that's perfect. And then and you did say that this was both for state access claims and the MCOs, correct?
Correct. Any claim that's paid with Medicaid dollars, regardless if that's paid directly by Access or through an MCO.
And will HMS, or this may be a question for HMS, distinguish or, you know, disallow the ones that, I mean, there's MCOs out there now that are doing heavy duty APDRG reviews.
Mm-hmm.
And, you know, they're already recouping, or, you know, et cetera, or it's set for state fair hearing, you know, either way. How are you going to disallow those? Or you'll know, just so we're not crossing. I've seen other payers,
Yeah.
you know, we do a DRG review, and the next thing you know, it's out there for a complex. All of a sudden there's 2 reviews. Okay.
So this is a great question. So here for Arizona, all of my MCOs are required to submit any fraud, waste, and abuse referrals, findings, or prepaid audits they want to do into my OIG, and we keep track of those. So as we work with HMS and they are telling us who they maybe want to take a look at, we all take a look to see that there is nothing overlapping in our system. If there is an overlap of a specific provider, we then look at the timelines to make sure it's not the same data service. So we do a lot of tracking. That is not to say it's going to be perfect or that there's maybe items
Right.
not reported. So if you receive a record request from us for a claim and it's in the middle of something going on with the MCO, I would want to know immediately.
Okay, so we shouldn't, again, like you said, nothing's perfect. So we really shouldn't expect to see any overlap. So, XYZ plan already did the APDRG review early last year. I wouldn't expect to see that same account come up for that same APDRG review. I
It
shouldn't.
may not come up.
but I
It
do.
should not.
Okay.
There could be an instance where we are looking at it for fraud, waste, and abuse, which may be something different than what they looked at it for.
No,
But I don't anticipate it being, there should not be significant overlap or those types of duplicates, if you will.
Okay, so you said just one more, sorry. So
You're
this is going to come out shortly, and as of now, there's no limit on how many claims. However, there is going to be a preliminary review, I'll just say by hospital, to say, okay, so here's what our initial findings are. So we're going to start, again, making it up. We're going to start taking a look at your, I don't know, your knee arthroscopies. And then we kind of go from, that's kind of I think the other lady, Rebecca, or somebody was questioning, how would we know? That would kind of give us a guideline on, okay, so our knee arthroscopies are going to be looked at. Something like that, right?
It won't be by topic though. So you will receive a medical records request letter from us with the patient name and date of service, and that we are looking for the DRG and or the claims relative to that. For that claim that was filed.
That'd be for the APDRG reviews, but the complex case, I'm assuming HMS is going to data mine. They're going to they'll go after, certain specific APDRGs, and then that'll be different than the complex case, right? The two will be different.
My understanding is that they'll be mixed and sent out at the same time, but I'll let HMS weigh in as well.
Okay.
Yeah, and I wanted to chime in on the limits as well. There will be limits applied to the medical record request letters that go out every month. So there will be a cap on that, so you will not receive, over that cap. The other thing I want to outline is that the finding letter will give you the specific details associated to what we found either in the complex review or in the automated review.
Right, but we don't know what the cap is yet or the limit is yet.
We do have limits established, and what they're based on the size and the spend. And I believe those limits are also posted on the portal page or the Access Provider website.
I don't know. I looked in that, I'll double check it, but I tried the provider portal prior to asking any of these of the questions. But okay, so I'll look for the limit. And otherwise I can reach out or email HMS, right?
Yes,
it will be on the resources page if you go to the link that we put in the chat. And if you also look at the FAQs that are attached to there, that will provide some additional information as well.
Wonderful. I thank you all. Thank you.
Angie, to answer your question about the claim selection on the complex versus the DRG, there are different algorithms used. And so we do not necessarily go off of the APDRG in order to select claims for complex. Did that answer your question?
It answers my question. I've just dealt with, auditors in general, and there are certain specific DRG like sepsis. Every auditor out there, I don't care which organization you are that's working for the payer, goes after sepsis. So it's just a common question. So, but I do appreciate it. I understand what you're saying. Thank you.
All right.
Seems that we're at time.
Yes.
So I want to go ahead and wrap it up, and we will go ahead and gather these questions and get those answers out to you accordingly, whether it's in a Q&A document or we add it to the frequently asked questions on the website. But again, feel free to go to those resources, look at the RAC websites, the provider portal, and if you have any questions, let us know. But we thank you for being on today and listening to our presentation. And everyone have a great rest of your day.
Thank you.
Bye.